Mike.
Health Subcommittee here. Madam Clerk, please call the roll, and then I'll turn the gavel over to Dr. Terry.
Representative Boyd.
Here.
Representative Byrd. Representative Freeman.
Here.
Representative Hall.
Here.
Representative Jernigan. Representative Kumar.
Here.
Representative Marsh. Representative Ramsey. Representative Sherrill. Representative Smith. Representative Terry. Chairman, you have a quorum.
All right, thank you. Before we get started, our chairman here of Sub had to go present a bill, so do any of the members have any personal orders? Okay, seeing none. Without objection, we're going out of order, and we're going to go to item number 20, House Bill 948. Chairman Boyd, you're recognized. You have a motion, a second. Is there an amendment?
Thank you, Mr. Chairman and committee. And I actually have two amendments on this one, Mr. Chairman. And I need to take the first one up, which is amendment number 6091. It actually makes the bill, and then I'll put the second one on later.
All right, let me find here. Okay, you have a motion second on amendment 6091. Okay, you recognize.
Thank you, Mr. Chairman. The amendment and ultimately the bill is going to do some much needed reform to Tennessee's certificate of need process. It's going to make it quicker. It's going to streamline it. It's going to make it easier and more cost effective for people that are seeking a certificate of need. It actually reduces the certificate of need regulation of certain facilities and services to provide greater flexibility, and it eliminates some of the protectionist aspects of the CON process, and would ultimately require the HSDA executive director to develop a plan to merge certificate of need with healthcare licensure into a single agency. This plan shall be submitted to the General Assembly for action no later than January 1st of 2023. And Mr. Chairman, if it pleases the committee and the chairman, I'd like to go out of session and hear from Logan Grant, who actually has a presentation and can take a lot of these questions.
All right, thank you. Without objection, he has been on the list, so we will go out of session. For the record, obviously, name and title, and happy to hear from you.
Thank you so much. It's a pleasure to be here. My name is Logan Grant. I'm the Executive Director of the Health Services and Development Agency.
Is the mic on?
Maybe I'm too far away from it. Can you all hear me? My name is Logan Grant. I'm the Executive Director of the Health Services and Development Agency. The legislation before you is the product of the CON working group that began meeting several years ago. And there was some legislation last year that ultimately was the compromise could not be reached between the House and Senate. And what is before you is a compromise that the House has reached with the Senate and would do a whole lot of great things for the certificate of need process, namely create a lot of regulatory flexibility by making the process much cheaper, quicker, and more efficient. And we can accomplish this by taking some of the CON review functions from other departments and bringing them in-house to the agency. This allows us to reduce the average time of a CON application review from about 120 to 160 days to 45 to 61. So reducing it by over 50%, which is very wonderful from our standpoint. So there's going to be a few services and facilities that are going to no longer going to be regulated by certificate of need. For example, hospitals will be able to increase the number of beds that they are licensed for without obtaining a CON. However, this would not allow hospitals to be able to initiate new types of services. For example, if there is an acute care hospital, it would not be able to add rehab beds unless it was already licensed for those rehab beds. Additionally, under current law, based on the 2016 Certificate of Need Reform Act, the non-pediatric MRI services were carved out for and counties with a population above 250,000. This would reduce that population threshold to 175,000 and add PET services. So a couple of, now 2 imaging services would be carved out in counties with a population above $175,000. Excuse me. Additionally, this would charge the agency with developing the development of standards and criteria that are currently developed by the Division of State Health Planning and the Department of Health. This will allow us to conduct a more public process, seek more input, and hopefully update them. The law would require us to update them once every 5 years, and we would have to go through the rulemaking process. A way that it makes the process simpler for applicants is by eliminating economic feasibility as a criteria for evaluation. So that will reduce our applications, the size of our applications, and thus the effort needed to fill them out, hopefully substantially. Additionally, by changing our revenue source, shifting our revenue source from entirely on application fees, our agency is going to be able to reduce our current application fee rates by more than half. And we've been able to accomplish that by shifting some revenue that was previously set for the Department of Health and bringing it over to the agency. I'm happy to answer any further questions you may have.
All right, thank you. While we're out of session, I'm going to catch our chairman up. We are on the first amendment on this bill, Amendment 6091, and we are out of session. We have not voted on that amendment, so I'm going to pass the gavel back to Chairman. Chairman Ramsey, you recognize.
Thank you, Dr. Terry. And I think we're ready for questions on the amendment. Did I see someone? Yes, Representative Freeman, you're recognized.
Thank you, Chairman. And we spoke earlier. I'd just like to ask some of these questions so the rest of the committee can hear. So we reduced the population threshold to 175. What was the rationale for that reduction?
You're recognized.
Thank you. In 2016, the Certificate of Need legislation established the population-based threshold, and the theory behind it was that eliminating a certificate of need for certain types of imaging services would maybe not be as deleterious to the healthcare marketplace in urban areas that could maybe bear more competition because they're more densely populated. So the plan at that time was to set it for just the largest markets. And as the CON working group met, they discovered that there really weren't any negative consequences from that carve out. So they wanted to see if they could continue to kind of move the needle down, expand it into more counties, and test the theory further.
Representative Freeman.
Thank you. Thank you for the answer. So one of the things that I also have concern with is the economically distressed status during the application and the removal of that requirement. So what happens when someone files an application and the status of that changes? At what point would it need to be deemed economically distressed? And
Mr. Grant?
Sorry. The agency board will have to promulgate rules to clarify some of the details of that process, but an option that will probably suggest to them is to make it the date of the, if the county is economically distressed, then they can bypass the CON board and apply straight to the Board for Licensing Healthcare Facilities for licensure. Mm-hmm. And so perhaps setting it at the date that they file that application might be a good date, but that's something that will be discussed further by the agency board.
Representative Freeman.
yeah, and last comment. That's really where my concern is that the number of economically distressed counties changes pretty regularly, and that moving in and out seems like a complicated policy to remove and have that kind of be a moving piece. So anyway, that's my comment. Thank you.
We have further comments or questions, and I guess that puts us all in a great mood. I appreciate that, whoever did it. We have further comments or questions of Mr. Grant? If none, we will, pardon, Chairman Smith, You're recognized.
Thank you, Mr. Chairman. And just for, because this is such a regulatory-heavy bill, would it be your testimony, Mr. Grant, that the purpose for reforming certificate of need over the window of time is to drive down barriers to allow more healthcare services to enter into markets that are currently controlled by monopolistic forces, thereby increasing access? Would that be a fair assessment?
I would say that this is about making sure that if we're going to the extent that we have regulations in place to protect patients and markets, they should only exist to the point that they are directly improving the competition, improving the quality of those services, and improving access. So,
Yes, Chair Lady.
Would it be a fair statement that currently the way certificates of need are enforced and applied, it allows an advantage to an incumbent facility or an incumbent system to keep out a market entry, such as a healthcare ambulatory surgery center, a practice, or something that might be able to offer care on a smaller scale, maybe potentially on a more efficient scale by the larger incumbent properties?
well, there are cases where we've had applications for small outpatient treatment centers in certain regions, particularly some, and one comes to mind in West Tennessee, where there's also only a single large provider of uncompensated care. So you would have in that particular case the major hospital that's serving a multi-county region opposed the creation of that the ambulatory surgical treatment center, and due to its opposition, the application was denied. However, I think that to the extent that there are advantages to the existing providers, I think that this bill addresses a lot of those concerns, and it does so by requiring opposition to state clearly to the applicant what the grounds for their opposition is. Up till now, on current law, they just have to state to the applicant that they plan on opposing, but they don't have to state the reasons why. That would be a major improvement. This bill would also restrict opposition to other providers that serve patients within a 35-mile radius. Now, under current law, the board has to, when making a motion to approve a certificate of need application, they have to state all the reasons why the application meets the standards and criteria. Under this legislation, it would kind of flip that over, and now they would actually have to clearly state the reasons why they are denying an application.
Chair Lady.
I just want to thank Mr. Grant, as well as thank Chairman Boyd for bringing this bill. This is a good bill to reduce barriers to entry, and also the fact that we're trying our best to increase access to care with competition. So thank you so much.
Do we have further questions of our witness? If I see none here, we're all certainly, Mr. Grant, we're on pins and needles worried that this legislation will and somehow jeopardize your position as director. Is this going to dry up your revenue? I'm just kidding. If no other questions, we will move on and go back into session. Thank you for your testimony. So we have the amendment before us. Do we have any questions or comments on this particular amendment? Any comments from the sponsor? If none, we'll be voting to put the amendment on the bill. All those in favor say aye. Aye. Any opposition? So approved. I do think we have another amendment, sir.
Mr. Chairman, that's correct. That's Amendment Drafting Code 6657.
6657. A proper motion and second on the amendment. Does this amendment make the bill?
Mr. Chairman, the last amendment made the bill. Okay. What this amendment does, it tweaks the bill a little bit to allow for nursing homes to be able to expand the number of beds by 10% over a 3-year period, which puts them in line with how hospitals are set up.
Great explanation. Do we have any questions or comments about the amendment? If none, we'll be voting to put the amendment on the bill. All those in favor say aye. Aye. Any opposition? So approved. We're back on the bill as amended with both amendments. Do we have comments or questions on the bill? If none, sir, we will be voting to send this bill to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Chairman of the committee.
Welcome back. If there are no objections, we've had a request because there are other bills that depend on this bill as well. This is item 34, House Bill 1027 by Dr. Kumar. Dr. Kumar, you're recognized on 1027.
Thank you, Mr. Chairman. House Bill 1027 deals with prescribers when they are indicted for.
Pardon me, sir.
I'm sorry, I have the wrong bill.
I think that's 1045.
Okay.
1027 pertain to,
Hormone treatments.
yes, sir.
Okay. I apologize. House Bill 1027 states that standard medical practice does not involve prescribing hormone treatment for gender dystrophic or gender incongruent prepubertal minors, except as provided. It further states that the healthcare prescriber shall not prescribe a course of treatment that involves hormones for gender dystrophic or gender incongruent prepubertal minors. A healthcare prescriber may prescribe a course of treatment that involves hormone treatments for prepubertal minors for diagnosis of growth deficiencies or other medical conditions.
And let me interrupt you. We have two bills here, and I'm told surprisingly that two amendments. I'm told that both amendments make the bill. So I would ask, do you have a preference, 4991 and 5771?
We are running 5771.
Okay, 5771. We will need a motion and second on that amendment. We have the proper motion and second. Sir, you're recognized on the amendment that makes the bill.
Thank you, Mr. Chairman. What I described was basically the amendment that makes the bill.
Do we have, let's go ahead and put the amendment, the preferable amendment on the bill. All those in favor of amending the bill with such, say aye. Any opposition? We're on the bill as amended. Do we have questions or comments? Dr. Terry, you're recognized.
Thank you, Chairman. And just my understanding, of course, from the research that I've done on this issue, the standard of care currently is not for them to give hormones to prepubescent minors in this case already. Is that correct?
That is correct.
Yes, sir.
Thank you.
Do we have further comments or questions on the bill as amended? If none, we will be voting to send this bill to full committee. All those in favor say aye.
Aye.
Any opposition? So approved. We'll go back to our regular calendar now. Thank you for the chance to hear these two bills. We have item 1, House Bill 345 by Chairman Carr. We have a motion and second on the bill. Sir, you're recognized.
Thank you, Mr. Chairman.
Were you playing the music there?
I
from
was. It
Dollywood?
was
Well, we-
Charlie Daniels, leave this long-haired country boy
we
alone.
certainly- Oh, we appreciate it. We appreciate it. It raised my spirits.
Sorry about that. This bill here is just a continuation of the elder abuse task force that I have sat on before and still a part of. Over the past few years, the Tennessee General Assembly has tried to strengthen the laws for the elder abuse, and due to the COVID-19, the Comptroller's Office report on financial elder abuse did not have a fully enough time to bring the report back to us. So we're just basically asking for the task force to continue until its work is done until January the 15th, 2022.
Okay, do we have comments or questions on the bill? Any discussion? Question's been called, no objections to the question. We'll be voting to send this bill to full committee. All those in favor say aye. Any opposition? So approved.
Thank you, Mr. Chairman, committee.
Yes, sir, thank you. We have item 2, House Bill 1355. We have a roundabout request to roll this to the Hill. The sponsor's not here in any manner. So we will roll that to the Hill if there are no objections. House Bill, let's see, item 3, House Bill 1061 by Chairman Vaughn has been taken off notice. Item 4, House Bill 1132 by Chairman Farmer. I don't see him in here. We'll put that to the Hill as well. No objections. Item 5, House Bill 980 by Chairman Williams. I know he's planning on being here. Pardon? And my understanding is, but now I think the one that we're talking about is item 6, 974. Here he comes. His brilliant clothing preceded him. Yes, sir. Sir, you're recognized on item 5, House Bill 980. Does it have a proper motion and second on the bill? Any amendments on the bill? Have an amendment on the bill. Does it make the bill?
Yes, sir. Yes, Chairman Ramsey, it does. Drafting code 5886.
5886. We will take a motion and second on 5886. Have a proper motion and second. We'll go ahead and put that on the bill. All those in favor say aye. Any opposition? We're on the bill as amended. If you'd like to discuss it.
Thank you, Chairman and members. This bill was brought to me by my local community. There's a big challenge as it relates to mental health services in rural Tennessee today. Matter of fact, if you present and are in need of mental health services in Putnam County, if it's not a 24-hour hold at Plateau Mental Health, you have to wait in line, sometimes as many as 48 hours, sometimes as long as 5 days before your citizens can be sent to Moccasin Bend, which would be the closest in the Chattanooga area. What this bill would do, it would eliminate the certificate of need process for rural Tennessee, with the idea it would stimulate mental health facilities in rural parts of the state. I recognize that the previous sponsor that you took up earlier also dealt with this subject matter. The difference between this bill and that bill is that my fear is if we remove CON entirely from the state as it relates to mental health, that we'll just have larger mental health facilities in the metro areas, and there won't be as much service in the rural areas where it's equally and by population probably most needed. That's what this bill does. I'm happy to answer any questions you might have.
Do we have any questions or comments to the sponsor on the bill as amended? If none, I think you've scored a direct hit, sir. We will vote on sending this to the full committee. All those in favor say aye. Any opposition? So approved. You're recognized on item 6, House Bill 974.
Thank you, Chairman and members. House Bill 974, I have an amendment that was timely filed as well. Drafting code 006168.
So do we have a proper motion and second on the amendment? And you said this does make the bill?
Yes, sir.
Let's go ahead and put the amendment on. If there are no objections, all those in favor of the amendment as stated, say aye. Any opposition? We're on the bill as amended. You're recognized.
Thank you, Chairman. Lots of discussion around the subject matter of opioid lawsuits. This bill follows a little bit more along the line of a Kentucky model. I'm happy to answer any questions the members might have.
We have Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman. And because we're a health committee about to enter into some discussions about litigation and things like that, could you summarize just to give us an idea of what the Kentucky plan is and how that might vary from another proposal that I think we're soon to hear? Thank you, sir.
You're recognized.
Thank
sponsor.
you. There's lots of discussion regarding the subject matter, obviously because it's new and settlements are currently underway in discussions in regards to the subject matter. This drafting language is arguably more along the Kentucky lines, which would send more monies back to the states or back to the locals where some of these originated. I think there's another bill in which you referenced that will be later on that is a little more monies to the state. I think we have good stakeholders involved in communication as it relates to this, and hopefully in the coming weeks, we'd be able to come to a solution that works for all Tennesseans.
Further comments or questions? And that's my understanding is that House Bill 1132 by Chairman Farmer is in close relationship with this bill. We are in negotiations, and were we to have another meeting for the subcommittee, we would be rolling these till next week, but we're not going to do that. We're going to try to finish today. Chair Lady Smith.
Thank you, Mr. Chairman, for indulging me. Just for the purpose of reading this into the record, I think that my chairman would also agree. Whatever solutions are formulated, we want to make sure that that this legislative body is involved in deciding the directions of monies and the appropriations, whether it's the Kentucky plan that we're going to model or some other. Could you speak into, for the record and testimony, the intent that would represent the 112th General Assembly about appropriations and oversight, so that, because we're all hoping that we go home pretty soon, and we want to make sure that we've kind of got some guideposts out there. Thank you, Mr. Chairman.
Chairman Williams.
Thank you, Chairman Smith. The premise behind this bill, and I think the counterpart of the bill, really was an opportunity in case the discussions regarding how the monies were allocated were not done. It was a court case. Like many court cases, the legislatures, sometimes their will is overturned. We see that a lot from the federal level in Tennessee today. But ultimately, this would give us an opportunity to remain as a body in the discussion while those negotiations are going on. But ultimately, if the agreements weren't decided upon before the legislature or this committee, subcommittee, or full committee closes, then we could opine on that and hope that the stakeholders can make a decision which is best for Tennesseans. But to answer your question directly, if the Attorney General and the local communities come up with a solution that works, then both mine and the other one would be unnecessary. And so that's the hope.
Chairman Terry, you're recognized.
Thank you, Chairman. And to echo the chairman's comments, there are two bills out there that do cover this topic, and it would be my votes today on both those bills would be to move those forward. We're under, this being our last calendar. There is something out there, I believe it's called the Parkinson Principle, and people will delay the work, whatever time frame that you give them. That's why we have so many people on last calendar. Mm-hmm. But by moving this bill forward and moving the other bill forward, we're on the clock. And so I think that puts everybody in a position to where you got to come to the table. And I think people are trying to come to the table and get that, but it's going to put it on the clock. And so that's my intent. Thank you.
Okay. Any further comments or questions? Did you want to be recognized?
I was just going to state
Chairman.
for the record that the Parkinson Principle has nothing to do with the great representative from Shelby County, even though he has been known to delay things at times.
Oh, is that right? Well, we're still looking into that.
Yes.
We have, I think the question's been called, no objections. We'll be moving this to full committee as amended. All those in favor say aye. Aye. Any opposition? So approved. You are recognized, sir, on, let's see, item 7, which is House Bill 158.
Yes, Chairman and members, I have an amendment just for the purposes of discussion. I'd like to put on the bill. That drafting code is 5423.
Have a proper motion and second on the amendment. Does the amendment make the bill?
Yes, sir.
Do you intend to move the bill forward?
No, sir.
Okay.
I simply wanted to discuss the bill because we had some people that were interested in this subject matter.
Okay, let's just go ahead and we will discuss the amendment before we put it on the bill then. That'll be fine. You're recognized to the amendment.
Thank you, Chairman and members. This bill is not new to some of you. Last year, I was able to carry this bill, worked hand in hand with Commission on Aging and Disability as it relates to Alzheimer's. As many of you know, I lost my grandmother 3 years ago to Alzheimer's after a long battle. Alzheimer's is a plague, if you will, for not just those who have Alzheimer's, but it's also for the families who seek to care for them. This amendment, which makes the bill that I wish to attach, is known as the Colonel Thomas G. Bowden Act, which establishes a pilot program to bring respite care to families struggling to care for their loved ones with Alzheimer's. As you know, we have a Choices program here in the state, which allows family members to care for their loved ones with some support from the state. What this would do is mirror for Alzheimer's care the same thing that we do for Choices for those families who are taking care of those family members. We know that too many Tennesseans are experiencing significant hardship, not just because of COVID, but also because of the care associated with trying to care for their loved ones. But paying for a full-time long care for those with Alzheimer's is costing the state over $1 billion each year. Our hope is that this respite program can provide some aid to families and may also reduce the costs currently covered by the state. This discussion today was really to bring light to this act and to all those families who are suffering and caring for those with Alzheimer's across the state. I'd like to thank Rachel Blackhurst for Alzheimer's Tennessee for her work and advocacy on behalf of these families. And with that, I'm happy to answer any questions regarding the subject matter or the amendment.
Okay, with the subject matter of the amendment, I think we ought to go ahead and put it on the bill, no matter the outcome. All those in favor say aye. Aye. Any opposition? We're on the bill as amended. Have any questions or comments? Further explanations? Dr. Terry, you're recognized.
Thank you, Chairman. I want to appreciate you for bringing this up. This is something that families are dealing with across the state, across the nation, and finding a solution and finding help, that's something that we have to take a serious look at and get this done. I applaud you for bringing this forward. Thank you.
Further comments or questions? Yes.
Thank you, Chairman. Thank you, Chairman and members, for the opportunity to discuss this important legislation. But as you know, we have policies here as it relates to how bills travel. In order to save this for another day to fight, I would ask that the committee would consider allowing me to take it off notice.
Any objections to taking the bill as amended off notice? If none, we will accept that and move forward.
Thank you, Chairman and members.
Thank you, sir. If there are no objections, we'll go to the heel of the calendar. We have had a great presence enter our domicile here with Attorney General Hubert Slattery. We'll welcome, sir. I think that's you behind that mask, isn't it? Okay. And then we will go to item 4, House Bill 1132. We have proper motion and second on the bill, and I think we had an amendment on there.
Yes, Mr. Chairman, committee members, and there may be 2 amendments, but the drafting code that we'd like to adopt is 6270.
Okay, have a proper motion and second on the amendment.
This
We
amendment
will, does the
writes the bill.
amendment make the bill?
It does, yes.
Okay, let's go ahead and put it on the bill. All those in favor of the amendment say aye. Any opposition? We're on the bill as amended, sir, if you'd like to discuss it or explain it.
Yeah, you know, and I believe Chairman Williams was up here just a few moments ago, and I have a bill that would also direct settlement monies from the manufacturers and distributors of the opioids here in the state of Tennessee. This would help direct monies and where they go and who they go to and who distributes them. So this is what this would do in a nutshell.
Any comments or questions? If not, we'll be voting to send this bill with the understanding that, as we had with the last bill, that there will be continuing discussions and that the legislators will be involved, the General Assembly will be involved in decisions that are made on behalf of our citizens. So no further questions. We'll be voting on sending this bill to the full committee. All those in favor say aye. Aye. Any opposition? So approved.
Yeah, thank you, Mr. Chair. And did we adopt that amendment?
We did.
We did, okay,
Yes,
thank
sir.
you.
Just that one. That's the one you wanted.
That's it. Yes, sir.
Okay.
Thank you
great.
so much.
We'll go on to item 8, House Bill 1464 by Chairman Cochran. You're recognized, sir, when we get you all cleaned up out there.
Thank you, Mr. Chairman. And House Bill 1464, so essentially it prohibits a healthcare provider from discriminating against a qualified person for receipt of a transplant or an anatomical gift based solely on a disability. And so the best example right off the top would be, if someone maybe had autism or Down syndrome and needed, let's say, a lung transplant, a healthcare provider could not say that this person could not receive that transplant based solely on the disability. One important part, though, I think we need to point out that, if that disability could ultimately hurt the viability of the organ, that's a separate issue. But as long as that disability does not affect the viability of the transplant, that disability alone could not be reason to deny the donation or transplant. With that, I'll yield to any questions.
Okay, any questions or comments about the bill? Yes, Chairman Boyd, you're recognized.
Thank you, Mr. Chairman. Sponsor, on this wouldn't prohibit them from taking into account other morbidity issues with people. If they had some other condition, that wouldn't qualify as a disability in this. Is that right?
Is that?
You're recognized, sir.
That is correct. Yes. So, like I said, as long as they're not taking solely that disability into account, if as long as that disability isn't affecting the viability of the organ, certainly they can look at any other factor that they would typically look at. That does not prohibit them in any way.
For the comment, Dr. Kumar.
Thank you, Mr. Chairman. Thank you. It brings up some deep questions about medical ethics. And those are difficult decisions made by physicians at times. Can you think of what we are trying to avoid here? Can you give me an example?
Sure. And I think kind of what we talked about earlier, I think obviously we're always, in general, we're promoting that culture of life and that every life is equal regardless if you have a disability or not. I don't believe that this is a widespread problem. I truly don't. But I think we want to make it very clear that just because someone in Tennessee has a disability, that you're not going to be overlooked for that reason alone. And it's very much in my opinion, very much a pro-life statement saying, look, every life is created equal, and you're not going to be overlooked on a transplant list, again, because you may have autism or Down syndrome or other issues that you may be suffering with.
Thank you. It's a fairly reflective thought, and there are ethical concerns, but I think you're elevating those concerns. Thank you.
Yeah,
thank you, Mr. Chairman.
Do you have further comments or questions on the bill? If none, we will be voting to send this bill to full committee. All those in favor say aye.
Aye.
Any opposition? So approved.
Thank you, Chairman and Committee.
Thank you, Mr. Chairman. And we move on to item 9, House Bill 891 by Chairman Leatherwood, and it's been taken off notice. No objections. That bill's taken off notice. We'll move on to item 10, House Bill 1080 by Chairman Sexton. We have a proper motion and second on the bill. We have 2 amendments, sir. Both amendments make the bill. Do you have a preference?
Thank you, Mr. Chairman. Yes, the amendment 6452.
6452, we have a proper motion and second on the amendment. And since it makes the bill, we'll go ahead and put the amendment on the bill. So all those in favor of the amendment, say aye.
Aye.
Any opposition? We're back on the bill as amended. If you'd like to explain the bill and the amendment.
I'd be glad to, Mr. Chairman, and I want to thank you for your tireless work on this and finding out what this bill does. All this amendment does, all the bill does, is creates a physician's assistant board. Right now, the TMA, they're not in opposition to the bill because we are just creating a board. And if you look to Title 63, the boards, they have nurses, podiatrists, psychologists, chiropractors, oversight, governance, physician's assistants currently fall under the Committee of Board of Medical Examiners. As more physician's assistants enter the healthcare field and serve as primary caregivers, care providers, the need for a board solely represents for oversight of these professionals is critical to ensure quality patient care. So we're just creating a board. That's all that this bill does. And so I'll be glad to answer any questions.
Do we have, Dr. Kumar, I think you.
Thank you, Mr. Chairman. I was just curious, how is this profession governed at this time? Who is acting as the board at this time?
Chairman Sexton.
That's a good question. If you'll give me just a moment, it is. They are the rules that purport to regulate the collaboration of physician assistants with physicians must be jointly adopted by the Board of Medical Examiners and the Board of Physicians Assistants. That is how it is currently done, and our bill makes no changes to that process. I don't know if that answers your question or not, and if it doesn't, we have Ms. Moffitt here, Catherine Moffitt, that'll be glad to answer that question a little more thorough for you.
Do we, is it the will of the committee that we go out of session and listen to testimony? If so, we're out of session, and you can introduce your testimony here. If you just identify yourself, please.
Good afternoon. Catherine Moffitt, the Executive Director for the Tennessee Academy of PAs. To answer your question, Dr. Kumar, so currently PAs are regulated by the Committee of Physician Assistants, who is, that organization is housed under the Board of Medical Examiners.
Okay, Dr. Kumar.
Thank you.
Do we have further comments or Dr. Terry, you're recognized.
All right. Thank you, Chairman. And so the amendment would create the own board, remove the Committee on Physician Assistants out from underneath the Board of Medical Examiners, and create their own board. Can you tell the committee how the rules would be governed at that point in time?
Ms. Moffitt.
Sure. So, yes, it would be pulled out from under the BME and put as a standalone board. The current statutes require that all collaboration rules be jointly adopted by both COPA, which is in existence now, and the Board of Medical Examiners. We did work out some language with the TMA that would continue the current rules that are governing that relationship between PAs and physicians, so that into next year, when the new board is created and the new board and the BME adopt joint rules, those will go into effect. But until any new rules are jointly adopted by the two of them, the current rules that are governing that relationship as of today will continue on.
Chairman Terry.
Thank you.
Do we have further comments or questions from the committee? If none, Ms. Moffitt, thank you for your testimony. We appreciate you being here. And no objections, we'll go back into session, and we are recognized for comments or questions on the bill as described by the sponsor. If no further questions or comments, we'll be voting to send this bill as amended to full committee. All those in favor say aye. Aye. Any opposition? So approved, sir. Thank you.
Thank you, Chairman. Thank you, committee.
We have item 11, House Bill 1539 by Chairlady Weaver, and that has been, That has been rolled, if there are no objections, to the first calendar of 2022. And we will go to item 12, House Bill 565 by Chairman Dixie, or Leader Dixie, pardon me. We have a motion and second on the bill.
Thank you. I have an amendment.
We have an amendment, sir, if you'd like to describe the amendment.
Okay. The amendment makes the bill, so this will be describing the bill.
Okay, 6236, proper motion and second on the amendment. We'll go ahead and put it on the bill because it makes the bill. All those in favor say aye. Any opposition? We are on the bill as amended. If you'd like to discuss it.
All right. Well, this bill will help dentists be able to administer shots, to administer the inoculations for COVID shots and vaccinations. So what it will do with the exasperation of the COVID going on, and we've had trying to get as many shots in as many arms as we can as possible, this will allow dentists to provide that service. They already give shots in the most probably vulnerable parts of the body, which is the mouth. So I think that they should be able to do this in the arm. So this will help, well, in a couple of ways. The problem it will solve, it will help dentists to stay in the training programs to learn how to administer these, to help administer booster shots, and it's a long-term solution, and then dentists need to know that they have this opportunity.
Do we have any comments or questions on the bill as amended? And I would say that for several years, the Tennessee Dental Association has made an effort to allow vaccines to be given in dental offices, HPV and these things. It's never been addressed. However, I think one of the rules passed by the federal government was that dentists could be allowed to give the COVID, and I think that's what this specific bill does, is just specifically for the COVID vaccine.
Just only for the COVID.
So there may be efforts in the future to include other vaccines, but yeah, I signed on your bill. Glad to be on it. Glad to see it pass forward. Chairman Terry, you're recognized.
Thank you. And I had a note here. Was the Department of Health going to testify on this?
Oh, is there any, unless there was question, we'd be glad to have our illustrious liaison with the Department of Health come forward, and no objections, we'll go out of session and discuss this. I hope it's all good news, sir.
Patrick Powell with the Department of Health. Chairman Ramsey brought up kind of, I think the department's point is that dentists have already been kind of, I guess, addressed by the Federal PrEP Act, which has allowed them to administer the COVID vaccine. So we don't know that this is a needed bill. The only other concern is the drafting as any licensed person that draws blood at a blood bank. We don't know of any, I guess, professions that would cover that aren't already authorized to give the COVID vaccine. I guess if there was someone in theory that was somehow drawing blood kind of outside of their typical licensure, that could somehow wrap them up in this as well. But ultimately, we just don't know that it's a needed bill because the Federal PrEP Act has covered dentists.
Okay. Do we have questions of our witness? Yes, sir. Chairman?
Thank you, Chairman. So from drawing blood, so a licensed phlebotomist?
So the department does not license phlebotomists. So they are not licensed under Title 63, so they should not be included in someone who could give COVID vaccine under this.
Right. Chairman.
Thank you, Chairman. And if this bill goes forward, assume if you come up with some objection to who this may cover, let us know before we vote on it, maybe if we have to amend it or anything in full.
I think that would be kind of the only concern, Chairman, is that if someone outside of, again, their typical practice, so a hearing instrument specialist who somehow was a phlebotomist at a blood bank, they are licensed under the title. However, they would be drawing blood as a phlebotomist, and despite being licensed under the title in a different provision, in theory, that language is wide enough to catch them on this. That would be our only continuing concern. And again, with dentists being, I guess, the primary goal, we feel like they're covered by the Federal PrEP Act.
And would you be willing to include language, Mr. Sponsor, that might reflect their concerns?
Yeah, if you would work with me on making
Yeah,
sure that
and
we could narrow that,
As we,
I would
as we
definitely.
go to the full committee. I would have further comments or questions from the witness. If not, we'll go back into session, no objections, and we're on the bill as amended. Questions been called. If there are no objections, we will turn the lights back on, and security. So we'll be voting to send this bill as amended to full committee. All those in favor say aye. Any opposition? So approved.
Thank you.
Thank you, sir. And we're on item 13, House Bill 1002 by Representative Love. You're recognized. Sir, you're recognized on House 1002.
Thank you, Mr. Chairman, and certainly I do appreciate the department working with us on this particular piece of legislation. We were trying to increase payment amounts for persons on some support systems from the state, but much of what's been done in the administration bill is going to take care of this and even more. So with that, Mr. Chairman, we'll take this bill off notice.
Okay, any objections? Dr. Terry, you're recognized.
Thank you. No objection to that. I just want to recognize your work on the working group and thank you for your participation on that piece of legislation, and let the members know that your input has been well received, and that bill is going through, and hopefully we'll get it through finance today. But thank you for bringing it.
Thank you.
Yes, sir. Further questions or comments? If no objections, we will take this bill off notice.
Thank you, Mr. Chairman and committee members.
Thank you, Mr. Sponsor. Okay.
May I ask a favor?
Oh, yes, sir. I'm sorry. I didn't see you there.
I had a bill further down the list.
Oh, sure.
While I'm standing here.
We will do that. My superior staff here failed to notify me of that fact.
Not a problem.
Yeah, we'll have to make them work overtime.
All right, I understand.
You are recognized, sir, on item 19, House Bill 996. Have a proper motion and second on the bill.
Thank you, Mr. Chairman. I have an amendment, but it was not timely filed. Is it possible to?
Since this is our last meeting, we will just pretend it was timely filed.
There you go. All right. Thank you, Mr. Chairman.
Are there any objections to that? If none, we will ask. Do you have the drafting code?
Drafting code is 005799. 005799, and I have someone here from the department that will.
Yeah, hang on just a minute. We'll look it up. These guys are stickler for details, but then they forget you got two bills. So
I understand.
What are we going to do with them?
We'll keep them around and thank them for their work.
I agree 100%. Does this amendment make the bill?
Yes, sir.
And one reason we want to accept it is we do have someone in the audience that wants to address it.
Correct.
Okay. You passed security, sir, so we'll take a vote on this amendment and put it on the bill. All those in favor of amending the bill as stated in the number, say aye. Aye. Any opposition? We're on the bill as amended. You can explain the bill to us.
Thank you, Mr. Chairman. And this particular piece of legislation simply would ask the department to report on the efforts to have an enrollment-based child care subsidy versus an attendance-based child subsidy. As we've all experienced, child care in the state is good, but when we have situations where daycare centers don't get their subsidy, it can become very difficult for them to operate them. And so we've worked with the department on this, and they're here to testify
Okay.
if someone wants to ask a question of the department.
If there are no objections, we will go out of session and welcome testimony from the department, DHS. If you'd come forward and identify yourself.
Thank you, Mr. Chairman and members. Suzanne Carr, Director of Legislation for the Department of Human Services. We did work with Leader Love and Leader Yarborough on the Senate side on this amendment. What it will do is just require the department to keep you guys and the public abreast of any time we change our reimbursement methodology. So currently we do utilize enrollment-based reimbursement. We just wanted to be sure that we had the flexibility if federal guidelines or guidance changes that we can pivot quickly and do a different kind of reimbursement.
Do we have any comments or questions from the committee? Yes, Dr. Terry, you're recognized.
Thank you, Chairman. And so enrollment versus?
Excuse me.
You're recognized.
Sorry,
yes.
Chairman. So previously, we used to reimburse for only the days a child was present for subsidy children. That is not how private pay works. If you have a private pay child, you pay for the entire week that they are, whether they come or not. So that was causing providers to not want to accept subsidy children, certificate funds. So we just switched to what is the market practice, and that's what's encouraged.
Chairman Terry.
Thank you. I'm good.
Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman. Do you happen to have any data on how regular and, are folks faithful to their attendance? I want to make sure that we're not awarding a subsidy and that people are not faithful to keep that.
Ms.
Thank
Carr.
you, Mr. Chairman.
Yes, Chair Lady. I can get that for you. I don't have that today, but we do have that data on attendance.
We have further comments or questions of DHS? If none, we thank you for your testimony and your hard work. We appreciate what you do for us. And no objections. We'll go back into session and move forward with this bill as amended. We have comments or questions of the sponsor. If none, we'll be voting to send this bill to the full committee. All those in favor say aye. Any opposition? So approved.
Thank you, Chairman, committee members, and staff.
Thank you. Appreciate you bringing that. That takes us to item 15, House Bill 1509 by Representative McKenzie. We have a proper motion and second on the bill. If you'd like to describe it to us, sir.
Thank you, Mr. Chair. There is an amendment draft code.
Okay.
004004.
We have a proper motion and second on the amendment. Does this amendment make the bill?
It does.
Okay, we'll take a vote on putting this amendment on the bill. Before we discuss it, all those in favor say aye. Any opposition? We're back on the bill as amended. You're welcome to discuss and explain it to us.
Thank you, Mr. Chair. House Bill 1509 authorizes the Department of Human Services to develop new strategies and encourages shared services that will help many of our child care providers keep their doors open and continue to provide the care that our state desperately needs. TCA code authorizes the DHS to perform a market rate study of daycare rates annually, and they employ the services of University of Tennessee Boyd Center for Economic Business and Research. And it allows, so the law allows them the option to conduct a statistically valid and reliable market rate study. So this bill would still study the market rate, but provide alternative methodologies for creating daycare reimbursement rates. There are shared services alliances that provide just a more streamlined and efficient processes to help our daycare providers. And bottom line, this bill simply allows the DHS to take the necessary action to perform these studies and help develop these programs, help combine resources and things of that nature. And finally, this legislation is supported by our friends at the Tennessee Quality Early Education, and the department has deferred on the bill.
Okay, so very thorough explanation. Do we have any questions of the sponsor on the bill as amended? If none, we will be moving this bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you.
Thank you for your explanation. We have to go back to item 14,
Thank you, Mr.
House
Chairman.
Bill 1262 by Chairman Hodges. That has been rolled to the first calendar of 2022. No objections to that, so approved. We'll move on to item 16, House Bill 1509, and item 17, House Bill 885. Okay. My crack staff has reprimanded me here. I've got to retrace. Forgive me. I mentioned item 14 and pardon? So I didn't mischaracterize that. No, you didn't. You just said okay. Okay, item 16, House Bill 886, and item 17, House Bill 885, have been rolled to the first calendar of 2022. No objections. We will declare that in effect. Item 18, excuse me. Dr. Terry, you're recognized as chairman.
Thank you. Chairman Ramsey, you're recognized on House Bill 1596.
And thank you, Mr. Chairman. This bill was given to me through the.
I need a motion.
Let's find it here.
Okay. You have a motion and a second.
And this bill was sent to me through the Senate. They wish to recognize and compensate the frontline workers during the pandemic, and with that, the intention is to require the health department to decide what medical personnel who are residents in the state and who have provided health care services during the effective period of the emergency to be given a stipend, one-time stipend of $1,500. The fiscal note, of course, is substantial, but and I think we've had a mention of possibility of an amendment that might require a certain number of hours spent in the defense of the public during that emergency, but that amendment's not on it yet. So with that explanation and pending any questions, I will ask that this be moved forward.
Any questions for the sponsor of the bill? Okay. Seeing none, we will be voting on House Bill 1596. All those in favor say aye. Aye. Opposed? Okay. Ayes have it. Bill goes on to full Health Committee.
Thank you, Mr. Chairman. We will move on to item 21. That's House Bill 489 by Chairman Terry. We have proper motion and second on the bill.
Thank you, Chairman and committee. Currently, well, what this bill does, it creates a rebuttable presumption that it is not abuse or neglect of a child or for a parent or guardian to administer hemp to the child by means other than smoking, and it prohibits revocation of parole, probation, or bail based on a urine drug screen that is positive for THC below a certain nanogram level. What we're trying to get at with this bill is to, since hemp is currently legal, we are trying to filter out those that are using a legal product versus those that are smoking marijuana. However, this bill currently did fail in the committee that it was in the Senate. And so with that explanation, I think this issue and this bill needs to be, I'd like for them to reconsider their action, but since they have not, I would like to take this bill off notice.
Any objections? If not, we will recognize that we're taking House Bill 489 off notice. Oh, I'm sorry, Chairman Kumar. You're recognized, sir.
I was just curious, what's the purpose of allowing parents to administer hemp to a child?
Dr. Terry.
Thank you, Chairman Kumar. The issue on this would be some of those providers may, either whether it's for seizure disorders or anything that they've had with their discussions with their pediatricians or whoever. But this was to basically differentiate between who's taking hemp and who's been smoking marijuana.
Chairman Terry, Chairman Kumar.
I still fail to understand any medical justification for hemp in epilepsy or anything.
Chairman Terry.
Thank you.
Thank you.
Further comments or questions? If no objection, we'll take this bill off notice. So approved. I have been castigated once again for my failure. And item 16, House Bill 886, item 17, House Bill 885, have been taken off notice. Is that correct, sir? Okay. So we're on the even keel. All right. We'll move on to House Bill 582, item 22 by Dr. Terry. You're recognized.
Motion. Second.
Have a proper motion and second on the bill.
Did we skip? Okay. Thank you, Chairman and Committee. And there is an amendment on this.
5562, I think. 5536.
5536. I'll motion that.
And I'll second.
All right. Thank you. As chairman, we are afforded 5 additional bills that are germane to our committee. This bill is relative to controlled substances, and it's my intent, since it's our last committee, to keep this bill alive in the event that there's a need before we close the full committee. The amendment on the bill would require the Department of Health to include the impact of COVID-19 on the 10 Together legislation in their report that is due at the end of this year. With that, I'll take any questions.
Is there any questions or comments on the amendment? We're talking, I think the amendment makes the bill.
Yes.
Let's go ahead and put the amendment on the bill. All those in favor of the amendment as stated, say aye.
Aye.
Any opposition? We're on the bill as amended. We have comments or questions on the bill as amended of Dr. Terry. If none, we will be voting to send this to the full committee as amended. All those in favor say aye.
Aye.
Any opposition? So approved. So we will move on to the plan of this committee is to recess and reconvene at 4:30. I see Leader Cassida has walked in, and I don't, are you going to be available at 4:30, or you just want to take care of it now? Okay, well, if there are no objections, we'll move on to item 26, House Bill 370. You're recognized. We have a proper motion and second on the bill. I think you have an amendment.
Yes, sir. The amendment makes the bill. And so if I could get a motion and a second on the amendment, then I'll explain the.
We have a proper motion on and second on the bill, on the amendment that makes the bill. Let's go ahead and put it on the bill. All those in favor of the amendment say aye.
Aye.
Any opposition? We're back on the bill as amended. I'm sorry, you actually have 2 amendments.
I just, if I, with the committee's indulgence, if I could just do drafting code 006246.
Okay, 6246
Yes,
is
sir.
the one we voted on.
Yes, sir.
How
That's right.
convenient.
That is
So we're
convenient.
back on the bill as amended, and you are recognized. Go ahead and describe the bill to us.
Thank you, sir. The intent of this legislation is to increase transparency and kind of keep the public informed on what's going on if and when the next outbreak occurs. There's the health department on their website will put those 6 bits of information, the number of tests administered, positive test, type of test used, symptomatic and asymptomatic cases. And again, the intent is so that the public, the state of Tennessee, knows exactly where we are on at any given time on disease and pandemic, when the next one hit, and it will.
Do we have comments or questions on the, yes, Representative Freeman, you're recognized.
Thank you, Chairman, and thank you for bringing the bill. I'm very much in favor of transparency, but my understanding is that what is different? Because I feel like we do this. Can you not find the information on a daily basis? I mean, our mayor, at least here in Nashville, we had daily updates of number of tests, how many positive, and I don't believe there was any intent to hide it, and I'm struggling to understand what we're trying to do here.
What you're
Yes, Chairman, you're recognized.
Thank you. What you're expressing is regional. So in Nashville, yes, but the state, those numbers were not available, and so my intent is to increase what Nashville is currently doing and make it a statewide point of information.
Representative Freeman. Okay, Chairman Kumar, I think you're next.
Thank you. Thank you, Mr. Is this also a part of this bill that the health commissioner and other officials will not be able to declare emergency, only the governor does?
No, sir, with the amendment, and so forgive me because there are 2 amendments. Please, if you look at amendment drafting code 006246, I'm only asking that we have 5 bits of information on the Department of Health's website, and that's all this legislation would do.
Chairman Kumar.
Thank you. I'll be finished.
Okay, Representative Freeman. I'm sorry. Did you want to go ahead, sir?
Thank you. So these 5 bits of information, or 6, is the purpose that they will be used to determine if emergency is needed, because we could be too late by the time the numbers rise here.
Right. Once, and I'm reading off the amendment, once or 5 days after this state of emergency is declared, it could be a pandemic, it could be an epidemic, then this information will be put up on the website, and that's it.
Thank you. Thank you, Mr. Chairman.
And Representative Freeman.
Thank you. Sorry. So we just put amendment 6246.
Go ahead and, if you would, Harris, repeat the number on the amendment.
006246.
So in my amendment packet, it actually says that it removes the Health Department, Commission, County Health Officer's power to declare a quarantine. If that's not your intent, I'm happy to issue a verbal amendment.
Chairman Cassidy.
Yeah, because that should be a different drafting code. No, that is not the intent. The intent, and what the amendment that I'm reading off of, that should not be on there, Representative. I don't know if I've got a misnumeration or what I have, but no, that's not the intent.
And the staff corroborates your estimation that that's exactly what the bill does. Chairman Marsh, you wanted to be recognized.
Thank you, Mr. Chairman, and that's exactly what Representative Freeman has exactly what I wanted to ask. Is it says in the amendment we have on the calendar today that it removes the Health Department commissioners' power to declare a quarantine.
Yeah.
So, but that's not.
No, sir. And I don't know what's happened, but I'm looking at the amendment, and my amendment that I'm reading from does not say that. Matter of fact, it deletes it. So
let me let the staff. Dr. Terry, I think you wanted to make a comment.
Yes, I think the way the amendment is drafted, Section 2 refers to the quarantine powers of the commissioner, and Section 3 refers to the quarantine powers. It just deletes those sections of the code. And,
Yes, sir.
and I think that what we're discussing is we probably need Section 2 and 3 not in the bill.
Okay,
Leader Cassidy.
okay, that makes sense.
Let me recognize the staff. Did you have a recommendation? Matt King?
Matt King from the Office of Legal Services. Yes, Chairman Terry, that's correct. Section 2 speaks to the Commissioner of Health's ability to quarantine. Section 3 speaks to the county health officer's power to quarantine and removes both of those. If I believe the amendment that is being discussed, in order to remove those two sections, it would just be to remove sections 2 and 3 and to redesignate section 4 as section 2.
Thank you. That's my intent.
I'm gathering that leader that you wrote this yourself.
What gave it away?
And that's your intent?
That is my intent.
Something that would be workable with you?
Yes, I do not want to touch what the Department of Health, that authority they have. All I want to do is get 5 bits of information up on the website. That's the only intent that I have.
Okay. So what?
6. Thank you.
Yeah. So what the chair stands for is a motion to reorient and remove those portions of this amendment from the bill. So the motion has been made and seconded to do that. Would you like to explain what the bill does without that in it?
Yeah, and I apologize again to the committee for missing that. Now that you pointed it out, I see where I messed up. So on section 1, the department has 5 days to once a quarantine or a state of emergency is declared, to put these bits of information on their website, which is number 1, total test administered. Number 2, total positive test. Number 3, types of testing used to diagnose. Number 4, number of cases of disease outbreak, be it epidemic, pandemic. And number 5, the number of asymptomatic cases. And lastly, the number of symptomatic cases. And those 6 bits of information would help the state of Tennessee just stay abreast on how the pandemic is and how it's progressing and what are we dealing with. Okay. That's the intent. And that's it. That's all I intend to do.
So with that explanation, what we need to do is take care of the motion to remove that portion of the amendment that makes the bill. Is there any further discussion about removing that portion, understanding what the sponsor actually wanted to do with the bill? If no discussion, all those in... Yeah, okay, this is amendment number 1 to number 1. All those in favor say aye. Aye. Any opposition? Okay, we're back on the bill as with amendment 121 that makes the bill. Further comments or questions on the bill as amended with both amendments? Chairman Marsh, you're recognized.
Thank you, Mr. Chairman. Representative Casta, do you feel that the county health departments will have any problem coming up with these 6
Many
topics?
of them do, and so this doesn't require the county health departments to come up with it. It just asks the Department of Health to glean what is given to it. So there's no directive to go to a Bedford County, which may or may not produce those numbers. It only says it produces and publishes what they have.
Okay, thank you.
Yeah.
If there are no further comments of the sponsor, we've had a request from the Department of Health to speak. And if there's no objections to going out of session, we will, and recognize our miraculous liaison with the Department of Health. Do you fully understand what we've done here, sir?
I believe so, Chairman.
I will find somebody to explain it.
My understanding is that the committee has adopted Amendment 6246 and has chosen to strike sections 2 and 3. Is that correct?
I think that's correct, yeah.
Okay. The department was flagged on the bill prior to that, sections 2 and 3 obviously did delete the commissioner's quarantine ability as well as the county health officer's quarantine ability, which is kind of derived from the commissioners. As far as section 1 goes, we have not done an analysis solely on section 1. Every amendment we've seen has included a removal of the commissioner's quarantine abilities, which we would be opposed to. Section 1, however, does largely require information that is already being produced on the state's website. The 89 rural counties are subject and are directly under the Department of Health. The 6 urban or 6 metro counties do work in a quasi-independent manner. We kind of work with them, but Nashville, Shelby, Chattanooga, Knox, et cetera, and then Madison and Sullivan are the 6 metros. The only concern that I have, without doing a further deep dive with our epidemiologists, is that depending on any particular outbreak, this may or may not be able to be accomplished. Depending on obviously everybody has COVID at the forefront of their minds, so right now, obviously we are able to produce a lot of this, if not all of it. However, the next pandemic, which I hope never comes, we may or may not be able to accomplish this. And so that is my concern in tying us to these specific requirements. Obviously, we have tried to be as forthcoming with information as possible. We have HIPAA concerns. We had to be, very careful with information early on with the low number of cases. As the cases grew, we were able to share, obviously, more information. So I appreciate Representative Cassidy's intent to be, open and transparent government. Please realize we do not want to hide anything. We are trying to be as transparent as we can, but without doing a deeper dive with our epidemiologists, I do have concerns about tying our hands to these specific factors, again, for a unknown possible future epidemic or pandemic.
Do we have questions or comments for our witness? Chair Lady Smith, you're recognized.
Thank you, Mr. Chairman, and help me walk through this because about a year ago, we were all focused on the case count, and then we moved into positive case count, and then we moved into test run. And for quite some while, if you didn't do 1,000 tests per day, you were deemed, bad county, really bad county. And while we were doing tests, because I worked very closely with our health department, which is one of the major ones, they were doing tests constantly, but so few of them were actually positive. And so I think that while I know this may be onerous, there were some significant economic decisions as well as closing of schools. I mean, there are people in my district who lost their business, period. It's closed. Lost their business, lost their income because of numbers that were derived during this window of time. And so while I do appreciate the fact that they're onerous, I also know that, when you read various media outlets and the information that's coming is these are the positive cases and these are the number of tests run, but we don't know what on scale. And then we're making directives and economic decisions based on just part of the information. I actually understand very implicitly why we need all the information. So I'd like for you to speak to that. Thank you, Mr. Chairman.
Okay. Mr. Powell, you're recognized.
And I don't know that it's and please don't take my words wrong in that we think it's too much work or anything of that sort. It is more about the concerns about patient privacy and whether or not, again, I'm a lawyer, I'm not one of our epidemiologists, but whether or not the next virus or the next situation that this would be applicable to really fits where we would be able to reveal all of these factors. It's not the amount of work. I mean, we are willing and able to put out as much as we can and are able, but again, without doing a deeper dive with our epidemiologists, I just don't know how effective or to what level we will be able to always comply with every one of these.
Chair Lady.
Thank you, Mr. Chairman. And again, I may be missing it because I did have to step out a few minutes ago, but I don't see that there's any identified information that's being tracked back to patients. It's an aggregate of the number of tests that are positive, the number of cases that are positive versus the number of cases. So with that, happy to listen to another explanation.
And you are correct, Representative. The issue becomes on small numbers of cases. Just 1 or 2 positive tests in a county can sometimes be identifying due to other extraneous factors. So it becomes a situation if we have this emergency declared and then 5 days later the counties are reporting, there may be hundreds or thousands of cases in Nashville, in which case they are non-identifiable. But there may be 1 in Lake County, which may suddenly become very identifiable. And so we have to be careful about protecting patient identifying information and patient privacy on those aspects. And so while we may only be revealing, again, 1 positive test, due to other factors that may be known in the community and everything else, that may be able to be tied back, is my understanding. So those are kind of their initial knee-jerk reactions to Section 1. Again, I would need to do a deeper dive with our HIPAA kind of compliance officers and our epidemiologists to know whether or not we could reasonably accomplish this. Again, we had only looked at amendments and the original language that always had quarantine abilities removed, so we were adamantly opposed on all of those, but I'm happy to do a further review.
Chair Lady Smith. Dr. Terry, you had your hand raised.
Thank you, Chairman. Yeah, and to the 6 items that are listed on here, the tests that are done, is it currently on with COVID is 1 out of 6? Is that done by the state? Is that about what's done right now, or?
That has radically changed over the course of the pandemic, Chairman. I'd have to see what the current totals are. As far as the tests being processed by the state lab, it has gone from the vast majority to a very tiny minority. I think it's probably less than that.
Thank you, Chairman. I have a follow-up because
Chairman Terry.
One of the issues that I had early on, and this was a question that I had posed, and not necessarily to you, but to, I think it was either to the commissioner or to Dr. McDonald, was the type of test, how many cycles in the PCR test? Because this is saying the total positive test, if it's 40 cycles and it's positive, is that a false positive? We just don't know. And I know that, I think Florida tried to get that, but the amount of tests that were sent to you, the results that were sent to you that were reportable, didn't necessarily give you that information. And so whatever we do on this, if it goes forward, those are some things that I think the representative and the department need to tighten this up so that we know what we're getting.
And on those kind of situations, Chairman, it depended on the manufacturer of the particular test as to the cycle threshold. So it wasn't a one-size-fit-all on that. It was part of the problem. So.
Thank you.
For the Chairman or Representative Freeman, did you?
Yes, thanks. So on the 6 types, how would we do an asymptomatic versus symptomatic? So somebody would come in and have a test taken, and then would we be required to follow up with them to see if they tested positive and then return symptomatic? Or, I mean, I understand the intent, but just technically, how would that happen?
That's a good question. Ultimately, I mean, that's another area where I'm not sure we could give really accurate information on that particular that point. So obviously, if individuals came in, they could say they're asymptomatic, and if they tested positive, we might be able to say at that point. But as to whether or not they ever develop symptoms, you're right, we might have to continue to follow up with them. And so there are some hurdles here that, again, myself and my lay knowledge of our epidemiologists still may give us some heartburn, and we may or may not be able to accomplish all these things to the level that I think is at least being desired.
Okay, let me do this. Let me impose on the will of the committee. If there are no objections, we will go back into session, and my suggestion would be to vote on this bill with the understanding that the Department of Health will do your deep dive between here and the full committee. And I know you're full of flags, so if you got flags, I know you'll bring them back to us. And so there's no objections. We'll go back into session. Thank you for your testimony. And I would ask the committee, any questions or comments before we vote on sending this to full committee, with the understanding that the Department of Health will have a chance to look at it before the full committee meeting. Any opposition to that? If not, all those in favor say aye. No opposition. So approved. We got.
Thank you, Mr. Chairman.
Yes, sir. Thank you.
Could I have a closing statement and with the attorney here? This legislation is designed to disseminate what you receive. It's not asking you to diagnose symptomatic or asymptomatic cases.
Okay.
It's not, it's
just make sure that they know that.
So I want to say that to
next
him
week.
before he left out.
Plenty of
Thank you for reading my
communication.
mind.
Yes, Representative Carringer, you're recognized. You have a bill on here, I think, that you wanted to say a quick word about. We got a couple of, were you gonna roll this bill?
No.
Oh, you're not? Okay, well, okay, what we'll do is, we will recess until 4:30. I hope everybody can be here. Sorry for you sponsors. And no objections, we'll be recessing till 4:30. House Room 1.
Thank you.